How do you know if you need help as a department or an institution with gender competency? I want to talk about that today, and I'm going to share with you at some point in a little bit a statement that if you find yourself as a department or an institution saying is probably a good sign that you actually do need help. So stay tuned for that. But if we think about first what gender competency is understanding gender, understanding the language and how to talk and discuss gender. And the reason that we wanna know it so many times people say, "Well, what does it really matter? You're talking about transgender patients. I don't take care of transgender patients. It's less than 1%." But being a gender competent provider does help your transgender and non-binary patients if you have them. But it helps beyond that. It helps their family members. It helps the cisgender men and cisgender women, especially those who feel like they don't really like the title men and women don't necessarily align with them. It's not that they don't identify that way, but oftentimes groups that have that name, they don't feel like they belong in those groups, even though they identify in such a way. The other benefit of gender competency, it helps providers decrease assumptions. And when they decrease these assumptions, it really allows them to see their patients as they are, who they are in all aspects of themselves. One of the biggest benefits I hear from providers that work with me. And the thing is, by doing that, it improves patient satisfaction scores, not just for transgender non binary patients, but for all patients. So, working on gender competency helps all of your patients. Now, this question of how do you know if you need help really came up for me when I was speaking with a department offering to give grand rounds. And I was told by multiple members of that department that they were good, that they were really good at inclusion and did not really have much fault in their gender inclusivity, that they were good. They had done the work and they were good, even though it took me less than 5 seconds to pull up their website to see that, at least per their website, there was no demonstration of all the hard work they had put in. Like, I had no doubt that they had knowledge and they had done the work, but why wasn't it demonstrated on their front facing thing that as a patient, if I were going to look to see what kind of knowledge they had, was not even there in the slightest bit at all. And it really made me think about this idea of like, where as practitioners in medicine do we ever think about anything like, we're good, we've got it, we've done it? I mean, like, think about this for a second. Can you imagine when we discovered penicillin? Like, no antibiotics at all. People died of infection all the time. And when penicillin was discovered in 1928, can you imagine if we were just like, "We did it. We don't need to do any more. We're good. We've discovered antibiotics. We discovered penicillin. We're done." If we were done at that point, there would be all the gram-negative bacteria that never would have been covered, and people would have continued to die of different types of pneumonia and a lot of GI bugs. You get the idea, right? If we'd been like, "We did such an amazing thing. We are all done." With all the people allergic to penicillin, sorry. All the penicillin-resistant bacteria, sorry. We're done. We did so well. We're done. We don't do that. It's not a growth mindset. We keep working, we keep learning. There's no other place. Even if we think about our own board certification within our specialty. Can you imagine, like in OBGYN, we do written and oral boards. Can you imagine finishing your boards and be like, "I did so well. I'm done. I don't need to learn anymore. I did it. I'm done. We're good." We don't. We keep learning. I don't think gender is any different. There are still things to learn. So I did end up going to speak to this department, and I do what I do, which is okay, so they don't need the baseline knowledge. They have it. They really did. And so I was able to bring what I bring, which is bringing together some of the things that affect patient experience going into the hospital or the clinics, but understanding it from the medical perspective. What are things that, from the medical perspective, we can change, but understanding how those things affect the patient experience? And they heard things they had never considered. Now, what they did with that information, I don't know. Did they still think they were good? I don't know. I didn't have further conversations. I give the information. And as I always say from the beginning of the talk, you can change nothing or you can change some things, or you can change everything. It's all up to you. All I ask is for you to keep an open mind to consider all these things of what would be the benefit of changing it and what would be the disadvantage. That's being open. I'm not asking them only to consider the benefit. Consider everything. What would be the benefit of not changing and what would be the disadvantage of not changing? Look at all things. And what are the other options in between? So I don't know what they decided to do or not to do from that talk, but I do want to say, as my late great father-in-law always said, there was room for improvement. And it really made me think, would they take, maybe nothing from my talk, but would they have room? Would they take that growth mindset and continue to improve if so many people from their department told me we're good, we know enough? Because one thing I have to say is, again, I talk to many different people around the country from different specialties, and some of the most inclusive individuals or departments I speak to have never said that to me. They they may be able to acknowledge, as they should. I think it's good to acknowledge the work you've done and, yes, celebrate it. They can acknowledge, like, we've done these things and they're proud of themselves, and they should be. The difference is they recognize where there's still work to be done. There's the and. We've done these things, great, and there's still work to be done in this area. And I think that and is what's missing. And because it's that we have to be able to see where we've done good work, what we're good at, not beat ourselves up, but also know where we're working towards, what we want to go towards, and looking at how that helps our practice and all of our patients. Because even if that institution, the one that told me they were good, if they had said, we have done all this work, we are good, and our website doesn't reflect the work we've done because, and then they explained it, then there's some intentionality there. Because the bottom line is what they think their website should look like may be different than what I think their website should look like. And that's because all of those decisions are going to be made based on values and the priorities of those values. And so those decisions are going to be made differently. And it's something I talk about with institutions. I can't make that decision for an institution or a department. They have to make it for themselves. But the thing I want to see is it made intentionally, and understanding that the decisions made intentionally and you understand the advantages of making those decisions, the benefits of them and the disadvantages, and what the loss may be in those decision making. And that is also something I did not hear. So if you are a department that says, we're good, we know all we need to know about gender competency, that's my red flag for you. That is my, tell me what you've done. Tell me how you know. Tell me what you know about the patient experience, the patient perspective. Maybe this department's getting really good with patient reviews. I don't know. But what I do know is I don't think this should be treated any different than any area of medicine, which is we always have room for improvement. We should celebrate the work that we do. We should celebrate the progress we make, the advances we make. I am all for that. And I'm all for looking at where we have areas to improve. I'm all for making decisions intentionally and understanding those decisions, who they benefit and who they may hurt, the advantages and the disadvantages. And if you ever want help with any of that, please reach out to me. I'm happy to help you, your department, your institution. Because like I said, it is a great way to improve patient satisfaction and your ability to deliver medical excellence. Because improvement matters.